All right, the event has started. Well, hello, everybody. I'm glad you're all attending there. You're joining in fast and furious still. But I'm Will Alexander. I'm your host from Dog Show Tips. And once again, on behalf of Pro Plan, I would like to welcome the Pro Club members and others joining us tonight for part 2 of Neonatal Puppy Care with Dr. Marty Greer. I have to tell you, Doctor, I had so many messages last night after the presentation. It was wonderful to read them. Everybody was so positive. They were so happy to listen to you. It was a great time. But before I get started, I'm going to go back to my comfort zone, and I'm going to ask you. I have this thing on Canine Chronicle TV where I ask 10 questions in 60 seconds of dog show people and personalities, and you're a personality, so I'm going to ask you 3 questions so I don't take up too much time. Are you ready?
I'm ready.
Okay. What TV show would you like to appear in, Dr. Greer?
Oh, I should have done my homework on this and known what questions you were going to ask me.
Oh.
Murder, She Wrote.
Okay. Oh, hang on. There we go. Sorry. We had a little glitch there for a second. Murder, She Wrote. Second question. Who would you like to play you in the movie about you?
Oh, goodness. These are hard questions. I was expecting something easier. Who would I like to play me? Bette Midler.
Oh, good choice. I might have to do the whole 10 questions with you at some point. Not tonight, but at some point. And the last question, this one will be easier for you. Okay. What breed of dog do you see yourself as?
Oh, I love this question. And I have said for years, people don't look like their dogs. They act like their dogs. I think I'm a little bit of a control freak. I am definitely a herding dog person. I'm definitely a herding dog. So I think a corgi is not that far off from what I really, I kind of like to be a little bossy and a little out ahead of the pack and a little in charge.
Yeah, directing people around. Yeah, it's good. I like it.
I'm afraid so. Yes, I am not a golden retriever.
Oh, wait, well, that's great. Thank you so much for letting me ask those questions of you. And before I turn it over to you, I want to talk about the presentation is going to be the same format as last night. There'll be a quick message from Pro Plan at one point, and there'll be a 5-minute break followed by a question and answer period, and again wrapping up around 9:30. Please enter your questions in the Q&A box, not the chat box. Same as last night. Just make yourself aware of that. And there were a few questions last night that we didn't get to, so please re-enter them, and we will try our best to get back to them. So, without further ado, Dr. Greer, it's up to you.
So we're going to go through a couple things that we didn't get, not the questions, but some things that were questions about last night's material. Then we're going to talk about feeding, colostrum, and plasma, life skills and environmental enrichment, then treat for the treatable, and normal neonatal development if we get that much time. So tonight's going to be a little bit more fun. Last night was pretty serious. The beginning was serious. It was about surfactant and breathing and cortisol and thyroid and chest walls and blood flow and things that are, pretty complicated issues. But tonight we're going to do things that are a little bit more fun. We're going to do some social things for puppies. We're going to talk about diagnosing and treating sick puppies. So we're going to do some other things. Last night, I had some questions about the coal tube. So I went back over to our drawer and pulled out a couple of the items that we use. So the tube we use is called a coal tube. It's made by Mila. It's a 20. So if anybody's looking for this, if they're on the veterinary side and they're looking for it, this is what we use. I use this laryngoscope to guide the tube into the back of the throat. And as you probably know, if you've used a laryngoscope, they don't come with a blue blade. But I learned this from a pediatric surgeon that is one of our dog breeder clients. And that's a piece of painter's tape. You can use any kind of tape on the underside of the blade. And that way, when you're pulling the tongue out and trying to get the tube to pass into the trachea of a newborn puppy, that gives you some traction on the tongue. So we put the blue tape on there, and then the stylet that we use is a modification of a TCI catheter. Once we use them once, they get thrown away. So instead of throwing them out, we've been modifying them to put in as a stylet. So we'll use the laryngoscope look where the larynx is, pass the stylet, then pass the blue coal tube around it, pull the stylet out, and then we can start ventilating the puppies. So this works really well in our practice. Even people without a lot of experience can get a trach tube down a newborn puppy. And then there were questions about the supply and equipment list and the drug and medical supply list. This was at the end of tonight's presentation, but I moved it up, and Alice has this for us as a link in some of the information. So this will be accessible to you, so you don't have to try and scramble to get this written down or take pictures of the screen. This is pretty much what we want you to have on hand for whelping. Now, you might find other things are helpful. You'll want towels and newspapers and, your cell phone charger and some of those things, but you're responsible for that yourselves. And then there were questions about using the Dealey mucus trap. And I really thought I had this slide in the presentation last night, realized when we got done that I hadn't. So this is a short video. This is John that works for me. He's now a veterinarian. He was a veterinary student at the time. And this shows him taking this puppy that's not breathing very effectively and getting it started. So the use of the Dealey mucus trap is pretty intuitive. You put the flat end in your mouth, you put the other end into the puppy's mouth about an inch or so, put it in, move it around, suction, you can hear the fluid. And then with a little stimulation, this puppy's going to go from not breathing and sounding really gurgly when he does breathe to breathing pretty effectively. And then on the table next to John is our C-section surgery report, so that we can track all of the resuscitation efforts that we do with these puppies, their birth order, the color of their towel, what time they were born, the person that resuscitated them, and the resuscitation efforts, along with their APGAR scores. And then there was a question about glucose. And in the US, we call that around 90 for a normal glucose, 90 milligrams per deciliter. But in the conversion, that comes out to 5 millimoles per liter on the Canadian scale. So those are the things that I think we overlooked. And then this is my dog, my darling first Danish Swedish farm dog that we imported. And she did drag this tube of Oral Cal Plus out of the trash and was laying on my bed, chewing on the end of the tube. And clearly this stuff must taste pretty good, because she would not have done this just to chew on the plastic. It's pretty tasty stuff that she was munching on. The tube was pretty much empty, so she's not overdosing herself, but she was more than happy to clear out the garbage can. So tonight we're going to start with feeding, because I hope you've all been fed. I'm going to have my dinner after we get done with this, because I never do well if I'm operating on a full stomach. So we're going to do feeding after that. So we're going to talk about bottle feeding, tube feeding. This is a picture of makeup sponge feeding. And a few years ago, this was circulating on the internet. And every now and then I have a client that comes in and they've watched the video, or they've done something with this. And hard and fast answer is no. No, do not makeup sponge feed your puppy. We're going to teach you how to tube feed so that you're comfortable with it after tonight, but do not makeup sponge feed your puppy. There's a lot of things wrong with this. One, they're going to suck in a lot of air. Two, you have no way to measure how much they're getting. Three, there's little fibers of petroleum-based product in the makeup sponge. Four, there's no way to clean and sterilize the sponge. It's just wrong all the way around. When this started circulating, I think the puppy's name was Lily, and there was also a picture of her with a neckband around her neck that kept her feet down. Well, part of feeding when a puppy is nursing is using their front feet. So they should be doing some kneading activity, sort of like a cat. When they're nursing, that's normal behavior. We don't want to discourage that. And we do not want to tube feed or sponge feed. We want to use tube feedings or bottle feedings if the puppies aren't nursing adequately. So if you've seen this video, don't do it. If you've done it, please don't do it again. It's not really safe for the puppy. The theriogenology list, the veterinarians that do repro, when this came out, the list blew up. There's usually a few conversations every day on that list. The day this happened, literally the list blew up. So please don't do this. So the question that a lot of people will have is, do I need to supplement feed my puppy? And the answer is, well, it depends. There's a lot of answers like that. So we talked about last night that we don't want puppies to lose more than 4% of their body weight in the first 24 hours after they're born. We used to say 10% was okay, but now we know that we don't want them to lose any more than 4%. And a normal puppy should gain 2 to 4 grams per day per kilogram of anticipated adult body weight. And that's kind of a complicated sounding formula, but it's really not that difficult. If you have a 66 kilogram dog, that means it's going to be 30 pounds. A 66 pound dog will be 30 kilograms. You can do the math. You can figure out that based on that, the puppy should gain 60 to 120 grams per day. There are 454 grams in a pound. So you can do the math, the calculations, whether you do this in pounds or ounces or grams or kilograms, you can do the math. And we want our puppies to be gaining every day at a nice anticipated rate. They should double their birth rate by 7 to 10 days of age. So if you have little puppies, they're going to gain less than big puppies because that's the way it works. Toy breed puppies are frequently between 100 and 200 grams at birth. Large breed puppies like golden retrievers are going to be around 400 to 500 grams. My corgis are usually around 300 to 400 grams. And then the giant breed dogs are around 700 grams. But of course, the birth weight depends on the breed and the rate of gain depends on the breed. And it's really interesting that dogs have such genetic diversity. They are the most genetically diverse species on the planet from what we understand. And if you look at their appearance, you look at their size. I mean, this picture of the Great Dane looking down at the Chihuahua is a pretty great illustration of how significantly different in size our patients can be. So you can look at Shelties that weigh 10 pounds and Shelties that weigh 60 pounds. It's really quite interesting to see those variations. So formula is a good substitute for milk, but milk and colostrum are always your best nutritional sources. You can collect colostrum from a bitch that's recently whelped. So if you have a bitch that's got a lot of colostrum, the first milk, and she's really got lots of it and not very many puppies, you can go ahead and collect the colostrum and save it. This is a Rottweiler, and I'm going to explain this Rottweiler here in a minute, a little bit more about her, but this is a Rottweiler that came in with 2 puppies. She had one male puppy that was not doing particularly well and one that was thriving. So the client recognized immediately that the small puppy was not doing well. So I took this fancy cup and collected 90 cc's, 3 ounces of colostrum from this bitch and sent it home with the client to feed the puppy because the puppy wasn't effectively nursing and did not have a cleft palate. So you can collect colostrum. So if you have a bitch that loses a litter or a bitch that has a small litter and she's got quite a bit of colostrum, you can very easily collect it and then you can freeze it for a subsequent litter when you need it. Colostrum is always better than any other source. So you can store it in the freezer. It's probably good for at least a year in the freezer. How long is colostrum produced? Only about 12 to 24 hours after the puppies are born. How long can the puppies absorb the colostrum or the plasma? Only about 12 hours after birth. So we need to get colostrum into these guys when they're really young, or we're not going to effectively be able to protect their bodies from infections with the immune system not being fully developed. Can you use colostrum from another female? I prefer only using colostrum in the kennel where it came from. I am reluctant to share colostrum between kennels. I'm always concerned that we're going to introduce an infectious disease, brucellosis, herpes, something else. So I'm pretty reluctant to share colostrum between kennels. I know there's kind of a thing right now on the human side that women will save extra breast milk if they have it and then sell it, give it away, whatever they do. One of my employees was doing this. And again, you have to be a little concerned about infectious diseases. So I'm pretty careful in sharing kennel to kennel. I'm a lot more comfortable saying, let's just stick to the kennel where the colostrum is produced. So canine colostrum is absolutely critical for neonatal health. In humans, a lot of their immunity comes through the placenta. In puppies, very little of it does. So in puppies, we have to get about 90% of our immunity from the colostrum and not across the placenta. So there's a huge difference in the placental type that dogs have compared to people and the transfer of antibodies from dogs to people. If anybody's really geeky, there's actually the most amazing website called Comparative Placentation. So if you're into the medicine behind placentas, it was written by a physician and it's absolutely a brilliant website. So if that fascinates you, go to the Comparative Placentation website and spend a couple of hours looking at the different kinds of placentas. So passive immunity can only transfer in the first 12 to 24 hours after life starts outside the uterus. So if a puppy doesn't effectively nurse and get colostrum or plasma in the first 12 to 24 hours, they're going to be colostrum deprived. And there's a strong correlation between depriving of colostrum and longevity. So even in the long term, it's very important that we get these puppies what they need. Early growth rates also have a strong correlation between the amount of colostrum they absorb and how well they grow. So very important, again, that we're getting colostrum into these babies. Before you feed any puppies, we want to make sure that we're getting these puppies warm enough. So you want to check the rectal temperature before you let them nurse or bottle feed or give plasma or tube feed. So important that we get them warm enough, slowly warm enough that they can digest their food. We talked about this last night. If they're cold, the food is going to foam up in their stomach. They're going to get bubbly. They're going to aspirate. They're going to end up with pneumonia. So it's a pretty serious thing. We need to make sure that their temperature is warm enough before we feed. So if a puppy will nurse, that's always best. Second best is taking a bottle. I like the MediNurser. We talked about this last night, made by Newbie. It's a German company. I like the Miracle Nipple. It does a good job. It comes in 3 sizes. I think there needs to be a middle size in Miracle Nipple because the small and the mini are pretty small, and then the large is huge. So it'd be nice to see something in between. I've talked to the people that make the nipples for Pet Egg. I don't know if you have those in Canada, but I've talked to the people that have the nipples at Pet Egg, and every time I see them at a show, I go up to them and I say, you know, your nipples suck. And I don't mean that in a good way. I mean that they just don't work. And they say, well, we sell them. And I'm like, yes, because when people have a litter, whether it's a litter of puppies or a litter of squirrels or whatever, they go to the store, they buy it. It doesn't work. They throw it away because it doesn't work. And then the next time they have a litter, they go to the store and buy it again, but it haven't gotten it any better. So it's still a really difficult. It comes without holes in it. By the time you punch holes, they're the wrong size. The nipple never fits the puppy's mouth or the kitten's mouth well. It just doesn't work. So Karen Cusack on Facebook, and now I think she has a website called Amazing Nipple, has made these nipples out of silicone. And they are actually formed by putting mold on the outside of different size bitches' mammary glands and developing nipples that fit the puppy's mouth much more effectively. They're soft, they're very pliable, they're really nice. I think I'm not sure if they're made out of food grade silicone yet or not. Those are some of the things that we have to be paying attention to. But they're a much nicer solution. And then on the right-hand side, you can see one that has a shield on it. So if a puppy is born with a cleft lip or a cleft palate, you can bottle feed the puppy with this, and that shield goes across the roof of their mouth so that they can effectively suckle from a bottle, but not aspirate fluid up into their airway. And then Ken Sundin, who makes the puppy warmer incubator and the puppy warmer oxygen concentrator, is working on nipples similar to this as well. He's installing some equipment this week. He's been sending me pictures of his equipment. So I know that they'll be producing nipples as well. So we're going to see some improvements in what's available to us for bottle feeding. In the meantime, the Miracle Nipple works pretty well. And not only does this work well for most size puppies, but I really like the amount of fluid that it holds. It only holds 15 cc's. So you can very effectively see how much fluid the puppy has been taking at a feeding. And what's nice about bottle feeding is a puppy will take a larger volume of formula. They can accommodate a larger volume of formula when it's fed with a bottle, because as they suckle, the stomach expands. When you put it down with a tube, you have to limit the amount. You can still effectively raise puppies that way, but you can't get quite as much formula down them as you can if you're using a bottle. Now, I didn't put any pictures up here of the Royal Canin products. They have a really nice kit that has formula and bottles in the kit. And I am allowed to talk about that tonight because Purina, unfortunately, does not have a milk replacer formula. For a number of years, Eukanuba had one, and it was the best milk replacer we ever used. And I really like the Royal Canin product as well. I don't talk about it very much because we can't get that product in the United States. It's got an egg base to it, and the US government does not allow that to be imported. So if you are looking for a formula, I really like the Royal Canin formula. I like the Foster Care, and I like the Esbalac goat's milk formula. So there are a couple good ones on the market. I am not a fan of the homemade diets because they are nutritionally incomplete. Even goat's milk is not nutritionally complete. I had a cleft palate puppy of my own a number of years ago. I fed him exclusively goat's milk, and they do gain weight nicely in goat's milk. They don't get much diarrhea, but it's not nutritionally complete. And when I took the litter of puppies in to have the ophthalmologist take a look at their eyes, he immediately identified the 2 puppies that had been bottle fed and tube fed extensively because they had nutritional cataracts. So we know that it's arginine and lysine deficient. And so without those those nutrients, the puppies are going to develop nutritional cataracts. And a good ophthalmologist can tell that from a regular cataract. But if you don't have a great ophthalmologist, or it's a new ophthalmologist, they may misidentify those cataracts as being a genetic defect. So it's something to be really aware of. So I stick to the previously made formulas, and I will make something up in the middle of the night to get through the night if you need something. But long-term, I don't like raw eggs. I don't like the nutritionally incomplete homemade diets. I don't like goat's milk. I really do like the products that are meant to be formulas. So here's our first poll question for tonight. There will be 2. And my question for you is, does tube feeding make you nervous? Yes, no, maybe a little. How do you feel about tube feeding? Are you like strong on it? Like, you can do this, no problem. I got it. I don't need any help with it. Or I still need a little coaching on it. Or, oh my God, I can't possibly do it. So good responses here. Okay, so most of us either are a little nervous or a lot nervous about tube feeding. So we're going to go through this. And I think it's important that you have a chance to use some resources here. So you good if we end the poll? I think we've got a pretty good response. We've got pretty close to everybody has responded. Yeah. So it's pretty clear people are not completely comfortable with it. So the way that I teach tube feeding is that I teach the 5 Ps. So at 2:00 in the morning, when you're trying to remember what to do, the 5 Ps will walk you through this. The other thing is, on Revival Animal Health's website, I have there's a typo on here. I have the video of doing this. So the same video you're going to see tonight is on the website. And I was at a meeting, the Therio meeting last year, with a speaker that is a board certified theriogenologist. And he said, so while I'm doing a client C-section, I send them out to the car and tell them to pull up on their phone Dr. Greer's video on tube feeding puppies, so that when they come back in, I don't have to teach them how to tube feed. I'm like, well, that's pretty nice. I'm glad that you find it useful. So the 5 Ps are: pre-measure the tube. So before you tube feed, you want to measure the tube to make sure that it goes from the tip of the nose to the last rib. If you do that, if you know that it's all the way down to the last rib when you pass the tube, you cannot be in the airway. You have to be in the esophagus. The trachea, the airway, divides at the shoulder. So if you only get in about half to 2/3 of the way, you could be in the trachea. If you're into the last rib, that tube has to be in the esophagus and not in the airway. Number 2 is make sure your puppy and your formula is warm. Yes, you should take your puppy's rectal temperature and make sure that it's warm enough. It should be around 35 to 36 degrees centigrade before you feed. And I know my daughter checks her baby formula with a thermometer. I'm old fashioned. I use my wrist. If the formula feels warm on my wrist, it's fine. Not too hot, not too cold, just right. Number 3 is pass with the chin down. Our tendency is to want to tip the puppy's head back and look at where you're going. And when you do that, you open up the airway. So you're more likely to get into the airway if you keep the chin up. So keep the chin down and pass to the left side so that you're down into the esophagus. The trachea is on the right, the esophagus is on the left. And then the most important step is, before you feed, pinch the puppy's tail or toes. And if you pinch them, you can hear them just cry. You don't have to make them scream. You just have to make them squeak a little bit. And that way you're going to know that you're not in the airway. If you're in the airway, the puppy can't cry. So if any of these 5 steps don't go well, pull out the tube, put the puppy down, go get a cup of coffee, come back, relax for a second, and try it again, and pull up the video if you need to. Do tube feeding accidents happen? They do, not often, but they can. But more puppies will die of starvation because you're afraid to feed them than will ever die of a tube feeding accident. So learn to tube feed. You never cut the tube short. You want to always have the tube long enough, but you just don't put it all the way down to the syringe tip. And just make sure that you have all the equipment that you need before you have puppies. The amount that you feed is 1 cc per 1 ounce of body weight. 1 ounce is 30 grams. So it's a 1-to-1 ratio if you're measuring in ounces. And that makes it easy for those of us in the US, because complicated math in the middle of the night at 2 o'clock in the morning when you're sleep deprived is a really bad idea. So it's a 1-to-1 ratio, 1 cc per 1 ounce of body weight, or 30 grams. And you want to feed every 3 to 4 hours, maybe every 2 if it's a toy breed puppy. So like I said, we're going to tube feed. So we're going to take this little puppy. So this is the Rottweiler whose mother you just saw me milking colostrum from. So this little kid, he has a brother that's doing really well. And there's him. Lay him on his side, and we're going to take so we're going to lay him down all the way to the tip of his nose. And that's going to be where that black mark is. So it's that full length. Okay. So it's about 16 centimeters that you're going to pass the tube. It's a long way. Pass the tube with the chin down, pass the tube to the left, slide it in slowly. Get to the mark, and then I'm going to hold the mark with my fingers so that he doesn't push the tube out, and then I'm going to feed. Okay. So let's do it. So pretty simple. All you do is measure the tube and pass it. You can lubricate it with a little bit of milk before you pass it, just to make it a little easier on the puppy. And then this is the owner of the Rottweiler, the puppy that was not thriving, and she's feeding colostrum, but formula works. So she's holding the tube in her left hand. She's right-handed. So by holding the tube in her left hand, when he champs his mouth like that, he's not going to push the tube out. And now this is the first time she's ever tube fed. So she's, a little awkward, just struggling a little bit. We're going to do this just one more time, because you're going to measure the tube. We're going to lay him on his side, and we're going to take from the last rib all the way to the tip of his nose. And that's going to be where that black mark is. So it's that full length. Okay. So chin down. So pass the tube with the chin down, pass the tube to the left, slide it in slowly. Get to the mark, and then I'm going to hold the mark with my fingers so that he doesn't push the tube out, and then I'm going to feed. Okay. So that's passing the tube. Pretty straightforward, pretty easy. Now I'm wearing gloves. The owner is not wearing gloves. That's fine. It's her puppy. I'm not worried about her giving the puppy anything or the puppy giving her anything. So she's just going to slowly feed the puppy. And you can see how he's champing. That's absolutely normal for him to be kind of doing that nursing movement. And you can hear him making those little sounds. So that tells you that you're in the right place. If you can cry, you're not in the airway, you're in the esophagus. So pretty simple, pretty straightforward. So this, like I said, she brought in the puppy. The bitch had 2 puppies. The first puppy was doing really well. The second puppy was not doing well. So we taught her to tube feed, sent her home with colostrum and formula and a feeding tube. And this is the puppy, the 2 boys. They were both males at 6 weeks of age. And I'm just going to challenge you to say, this is daughter, this is mother of the owners. But I'm going to challenge you to say that you probably can't tell which the runt puppy was looking at this photograph. And for the people who say, well, it's just a rump puppy, I'm going to let it die. It's not worth saving. There's probably something wrong with it. I'm going to show you this picture of this puppy when he's 9 months old. He was beautiful, absolutely a beautiful puppy. By 9 months of age, he had already won the best in-show puppy match at the local show. So this was a puppy that was worth saving. Did she lose a few hours of sleep at night? She sure did. And it was worth it. So the 5 Ps: pre-measure the tube, pre-warm the puppy and the formula, pass with the chin down, pass to the left, and pinch before you feed. You can pinch the tail, you can pinch the toes. I have corgis, so if I pinch the tube or the tail really hard, it's not going to hurt anything because they're going to get docked. If you don't have a tail that you're comfortable pinching, pinch the foot pad, pinch the toes, just enough that the puppy can vocalize. And as soon as you hear that vocalization, you can go ahead and feed. So what you need is a formula, like a milk replacer. You need a feeding tube, a syringe, a marker to mark where to pass it to, a thermometer so you know how warm the puppy is, and a scale so you know how much to feed. Very simple setup, not complicated. Have it before you need it. If you're going to have a litter of puppies, buy the stuff, have it on hand. It's like $20 worth of stuff. And if you don't need it, great, put it away for the next time. But if you do need it, you really need it. This slide shows the difference between cow milk, goat milk, and dog milk. So this demonstrates that dog formula is not the same as cow milk and goat milk. So please don't substitute cow milk and goat milk for dog milk replacer. Use the right product. And then for brain and eye development, DHA is absolutely critical for the development of brain and eyes to be normal. DHA is a really interesting nutrient. It was studied pretty extensively, and at Canine Companions for Independence, which is a service dog organization based out of California here in the US, they studied 200 nutrients to see if they could determine what was changing as the bitches aged, because they discovered that when the bitches were delivering their first puppies, that 50% of their puppies that they had were graduating from a service dog program, but by the fifth litter, they were down to 25%. So after they looked at 200 nutrients, they determined that DHA was the source of that. And we know that bitches are depleted from DHA. That's a fatty acid that's found in fish, and some other sources, that the bitches were depleted in DHA. And so the puppy's brain development and their eye development wasn't as good. So we start supplementing DHA if we have bitches that are going to have multiple litters. And I've had clients do this on their own. And of course, it's pretty anecdotal, but their impression is that we have smarter puppies when we have supplemented DHA. So you can buy it. It just comes as a fish oil capsule. You can turn the bottle around and see how much DHA is in it. It also reduces the progression of senility in people. So write it down, because if you're older, you're going to forget to go buy DHA. So take a note, write down DHA, go to the store, buy it for your dog, buy it for you, start taking DHA. It's going to improve your brain. It's going to improve the puppy's brain and eye development. So do it. Feeding frequency. This again is a graph that shows the frequency of feeding and the ability of puppies to gain weight. So feeding more often is better than less often. And then supplemental feeding, you'll see a significant decrease of neonates at risk if you're supplementing. So if you have puppies that aren't gaining as well, adding that supplemental feeding either with a bottle or with a tube feeding can really improve your puppy survival rate. In my world, nobody starves to death. So tube feeding is really important. I have corgis. Eating is a very important activity in their life. Now, no one will ever accuse me of starving my husband, because if you've ever met him, he's a good-sized guy. No one starves to death under my roof. There are reasons we lose puppies. We talked about some of those reasons last night: genetic diseases and poor delivery and bad mothering skills and all kinds of things. But in my world, no one's going to starve to death. If they're not going to thrive, it's not because they're starving. It's because something else went wrong. So please, please, please feed your puppies. I cannot overemphasize the importance of making sure that your puppies get enough groceries. To keep them weighed, one of the things that you can do if the platform scale isn't working well for you, because by the time puppies get to be a couple of days old, they start to get pretty active, and it can be hard to get them weighed accurately on those little platform scales that wiggle. So this is a trick that I learned from my friend Laura Reeves over in Washington State. Is she uses a fish scale. So she uses the scale that you take out in the boat to weigh your fish. You can put a puppy in a mesh laundry bag. So you can buy these at Walmart, buy the fish scale. It's like $10 at Walmart for the fish scale, $2 for the mesh bag. And you can put the puppy in the bag and then lift it up off the table, and you can accurately weigh puppies that are too wiggly to sit on a platform scale. So cute little trick. And when I say fish scale, I mean a scale you weigh fish with, not the scales on a fish. So this is Dr. Almond weighing a puppy at our practice with a fish scale. Once you're done feeding, don't forget to stimulate him to urinate and defecate. You all know how to do that. Colostrum does come in other forms. This is a bovine colostrum supplement. This is not the same as dog colostrum. So if you're trying to substitute something, you need to have either a dog formula like colostrum from a real dog, or you need to have plasma to substitute it. There are advantages to colostrum, but it's not going to replace the immune system's benefits of having dog colostrum going into your dog. So this bovine colostrum is good, but it's not as good as dog stuff. Next, I want to talk about water. Water is the most important nutrient that we give our dogs, and sometimes I think we forget that. I use a shallow, heavy dish when I start watering my puppies, and when they're outside, I use this chicken waterer because it keeps the leaves and the sticks and all the other things out. It also keeps puppies from taking a bath in their water bowl. So it's just a nice, easy way to keep puppies clean and dry and keep the water available to them. There's also these really great Lixit bottles, and I have used Lixit bottles from about 20 years ago. I started doing this with my puppies. I had a litter of 10 corgi puppies, so I had a lot of puppies. I know those of you with large breed dogs are used to large litters, but 10 was a lot for us. So I started teaching them to use a Lixit bottle. You can hang them on the crate or the X Pen. You can put them in a device like this. It's a homemade device made out of PCV type tubing. But you can teach puppies as early as 3 weeks of age to drink water out of a bottle. Now, you want to make sure they still have access to a bowl until you know everybody's drinking, because you don't want anybody to be left behind. But you can put chicken baby food or peanut butter or something on the tip of this bottle, and they'll learn to drink out of a bottle. This is a great technique for travel. It's a great technique for dogs that are messy at their water bowl. If it's a good technique for dogs that have any kind of problems with their mouth with not drinking very well. And these are the bottles that are sort of like a gerbil bottle or a hamster bottle. They're a large bottle. You can buy them as large as 64 ounces. So they're like a half gallon. And they have a metal tip with a metal ball at the end of it so that the water doesn't run out, but the dogs can go over, and by them jiggling that ball in the tip, they can get water accessible. It's great for dogs that want to drink too much at one time. You can leave it attached to their crate so that they can have a little bit of water during the day when you're gone, and you don't feel guilty about leaving them without water, but they're not taking a swim in their water bowl. So it's a really great technique to use. And then we need to talk about feeding, because feeding is very important. Not quite as important as water, but it's pretty close. So you can start weaning puppies very young if you need to. This is a litter of collie puppies whose mother had mastitis. They're 12 days old. You can't really see very well, but their eyes are not yet open. So these puppies have never seen solid food before, but mom is sick. She's not producing enough milk. So we took the canned formula of dog food and put it on a very flat plate. This is Corral, very flat plate. And the puppies are already over there finding the smell. Obviously they're a little messy walking through their food because they can't see yet. Their eyes aren't open, but this is a great technique to use if you're having puppies that are very young and you need to wean them prematurely. You can wean as early as 12 days if necessary. And then when you're transitioning from a semi-solid to a solid food, again, I use a shallow, heavy, I usually use a pie plate, a glass pie plate, because they're nice and heavy. They go through the dishwasher well. Every now and then you'll have a bitch that vomits for her puppies. I've got a bitch that did that on her 4th litter. Never did it before, but by the 4th litter, she was like done with them. So sometimes you'll have a bitch that vomits. Don't confuse that with a dog that's sick. She's just trying to feed the puppies. You can feed in the pie plate. You can feed in a device like this. This is a feeding board that has holes in it for these bowls that one of my clients built. You can find all kinds of nice ones like this online. All right, passive immunity, like I talked about, not only is colostrum a way that we can get immunity into our puppies, but if they don't nurse because the bitch died, because the bitch didn't have colostrum, because the bitch didn't nurse, because there were too many puppies and they didn't get enough plasma or colostrum, or if you have sick puppies, I use a lot of plasma in my practice to help puppies that are sick. So any puppy that's sick or any puppy that was colostrum deprived gets plasma in my world. I buy mine from Hemopat, which is here in the US. It's a blood donation company run by Gene Dodds. You can harvest your own blood from male dogs in your kennel. It should be a male dog, not a female. And you can draw the blood off sterilely, spin it down sterilely, get rid of the red blood cells, and just give the liquid part of the blood, which is either plasma or serum. Serum is the liquid from clotted blood. Plasma is the liquid from unclotted blood. But anytime I have a sick puppy or a puppy that's not doing well, or a puppy that was colostrum deprived, I will give them plasma. Now, the standard dose, no matter what size the puppy is 16 cc's. And I divide that typically over 2 to 3 doses in the first 24 hours. If it's in the first 12 hours after birth, you can give that with a feeding tube. They're not going to take it out of a bottle because it doesn't taste like something you want to drink. But after that, you can put it down with a feeding tube and probably use it later on if the puppy has really severe GI disease, like really bad diarrhea. They do use colostrum in baby calves for bad diarrhea. There are studies that are published on that in cows. We don't have anything published in dogs, but if I have a puppy with something like really severe diarrhea related to parvo, I may go ahead and give some of that plasma orally, knowing that it's not going to be absorbed, but knowing that I'm going to get a local immune effect in the GI tract because it is still going to work there. So the information about this was published in 1992 This is not new information. This has been around for 30 years. So this is information that we're still using and I think is really valuable. So I use a ton of plasma. It works for kittens too. There's different articles on that if you're raising cats, but this is the original article from 1992 that was published showing the value of plasma. So if your veterinarian wants to see the information, you can have them pull up this resource and they can read it. Fresh frozen plasma, we buy it from Hemopet. Like I said, it comes from greyhounds in her Jean Dodds's kennel. It comes in bags that are about 110 cc's. You can keep it frozen and it's effective for up to 5 years in the freezer. When you thaw it, you need to thaw it with a thermometer in the water bath, because if you overheat it, you're going to damage the plasma proteins. So you don't want to throw it in the microwave. You don't want to put it in hot water. You want to put it in tepid water, let it thaw. But you also have to be really careful that you keep it sterile because it is a great medium for bacterial growth. So you can't leave it sitting on the counter for a day or two. You've got to get it right back in the refrigerator if you're not going to use it immediately. But you can thaw it carefully and refreeze it if you're having the need to keep this in their freezer. I like for my clients that are frequently raising small breed puppies that struggle, I like for them to have plasma at home so that they can go ahead and administer it. We have a fairly high number of clients that will have us dose their puppies with plasma before they leave from a C-section. So I will try and get as much plasma into that puppy as possible. Again, it's 1 cc per 1 ounce of body weight or 30 grams of body weight. So if I have a 5-ounce puppy, they're only going to get, or I'm sorry, 150 gram puppy, they're only going to get 5 cc's with a feeding tube. But you can give the rest of it subcutaneously by injection. You can give it into the bone if you've got a puppy that's really, really sick. But I usually give some of it sub-Q and some of it with a feeding tube, and then I don't have to send it home with clients. They don't have to try and remember how to give it, when to give it, all the things about thawing it out, all the things about keeping it cold. We just go ahead and administer it at the C-section. It runs about $75 a puppy for us to do that. But when puppies are selling for $3,000 or $4,000, it's worth $75 to save puppies. Litter box training. I'm going to ask the next question of our poll, and that's, if any of you litter box train your puppies. Good. Living in the Great North, I'm sure there's a lot of value in not trying to get your puppies outside in January, where the snow is deeper than the puppies are tall. Good. So I'm glad to see a lot of you are already doing this. I did a lecture a couple of months ago in Missouri, and this generated a ton of conversations. So I thought we should talk about it tonight. I tend to use, for my medium, I tend to use Marth wood pellets. Other people use other things. You can use pelleted newspaper. You can use wood shavings. I don't use cedar because that's too aromatic, but this is what the Marth pellets look like. The bag that I have here is what we sell in the US, but they're these little wood pellets and they break down with urine on them. Works really well. If you haven't litter box trained a puppy, I would encourage you to try it because it's really pretty fun. I use these metal paint trays like I have here and in the picture. The metal ones work really well for me because of the corgis. I pull these legs out straight so that it's really shallow on one end and then deeper on the other end, so that the puppies keep the litter box the litter pretty much in the litter box. And then I use these inexpensive disposable liners. These are 3 for $1.88 at my local Walmart. So I'll clean out the box a time or two, but if it gets really messy, I just throw the liner away and then put in a fresh liner, and off we go with a nice clean litter box. Now there's a couple tricks to it. If you haven't done this, if you have, maybe somebody will have some suggestions they can put in the chat for each other. But there's a couple tricks to it. One is getting it in at the right age. If you get this in when they're about 3 weeks old, the puppies do well. If you wait until they're 4 or 5 weeks old, frequently by then they've already developed some habits that are difficult to break and it doesn't work very well. This is my whelping box. It's got a little bed in it. It's got the tray where the whelping nest that was heated was. I just unplug it so it's not heated and I put my litter box there. And then next to that white mat is a bath mat. We'll talk about bath mats in a few minutes. But you need to get it in when they're about 3 to 3.5 weeks old before they develop bad habits. In my experience, the girls do a really good job of using it. They urinate and have stools in it. The boys tend to have stools in the litter box, but oftentimes they put their front feet in the litter and then their back feet are next to the litter box. And I don't want to say anything derogatory about men right now, but I'm going to say, we'll just say that the boys aren't quite as specific about using their litter box as the girls, because they're urinating just on the outside of it. Now there's another big tray on the outside of my whelping box. This is in my bathroom. And I have found that the bitches that are home raised will at 2 o'clock in the morning, when they can't wait to get outside to urinate and have a stool, and I may be sleeping and didn't hear them that they needed to get up and go outside, will use the litter tray if they were home raised at my place and were litter box trained as babies. My dogs that I've purchased from other people that I didn't raise tend not to do that. The other important trick to doing this is to make sure that the litter box is far away from the door that you walk in and out of the room from. Because if it's right at the door, the puppies are going to see you come in, they're going to run through the litter box, and then they're going to get stool on their feet, and it's not going to be very neat. So if you put it at the far side of the box where you keep the puppies, they're going to stay cleaner and drier. The other thing is these black litter or paint pan liners. I don't have very good luck with those. You can see these puppies have moved that around, and it's no longer well seated in the tray. So the little white ones seem to work better for me than the black ones. That's personal experience. The other thing I was going to show, and I forgot, is for feeding puppies. This is one of those nice plastic trays that you can buy at the dollar store. It's got little chambers in it. It's fairly shallow. This works really well for feeding puppies. And I also use these chip and dip trays. Again, they're like $1 at the dollar store. So you can put the food in these, and the puppies tend not to want to lay in these and take a wallow bath in their food. So it's just a little easier to keep the puppies clean and dry when you're not using a big bowl of water, when you're using these kind of chip and dip trays, and when you're using litter boxes. So I like to try and keep the puppies clean. I like for people to see clean puppies. I don't want people to see that I have messy puppies, and I'm sure you don't either. And bathing them gets to be kind of a challenge. So I want to keep them clean and dry and well fed, and the stools out of the way. So tips and tricks. We're going to talk about some other kind of fun things, tips and tricks about taking care of our puppies, raising social puppies. I think tennis balls are a lot of fun. The Super Dog program is one that Carmen Battaglia has talked a lot about. Some people pronounce it Battaglia, it's Battaglia. And that's a 5-step program that we're going to talk about here in a second, called early neurological stimulation. And from the Super Dog program, raising dogs that were effective in wartime to sit in foxholes with soldiers, they found that they had better cardiovascular performance, less stress, just dogs that were better able to handle those kinds of situations. And if I was sitting in a foxhole with shelling going on over my head at war, I would want a well-socialized dog. So the 5 steps to this are, first step is to hold them head up for 5 seconds. So from day 3 to day 16, you do these 5 steps. So head up for 5 seconds, 1001, 1002, 1003, 1004, 1005. Head down for 5 seconds, not swinging them, but just holding them down for 5 seconds. The 3rd step is to hold them on their back for 5 seconds. The 4th step is to put them on a wet, cold towel, or in my husband's world, he uses a cold can of Mountain Dew because he always has one of those with him, but doesn't always have a cold, wet towel. And then the last step is to do tactile stimulation on their foot. So we know that by doing this, that we do improve the ability of these puppies to tolerate stress. We can tell which puppies had early neurological stimulation done with them when they come into the veterinary clinic. We did a litter of Whippet puppies the other day that we were hearing testing, and they were these beautifully social, cooperative little Whippet puppies doing the hearing testing. And one of my technicians looked at the client and said, "Did you do ENS?" And she went, "Oh, of course, I always do." You can really tell the difference on puppies. So if you haven't been someone that buys into the early neurological stimulation, I would encourage you to do it. If you really want to be scientific, do half your litter and don't do the other half, but remember which half you did and which half you didn't, and see how you like it. But I'm going to tell you that it's going to be a lot more fun for you to place these puppies in homes when they've been socially worked with. This is sort of a fun game I use for people in the exam room, but you can do this if you're at home and you're working from home and you need to do a Zoom call and you don't want the puppy interrupting you. This is a muffin tin, again, from the dollar store, That's a ginger snap with peanut butter underneath
What
it.
she's eating.
And we have
She
this
sent me
adorable
a
little
photo.
French bulldog puppy.
Okay.
So you can fill each of the 6 holes of the muffin tin with peanut butter or chicken baby food or cheese and something to kind of adhere it down. So this puppy is going to keep busy for a long time when you're on a phone call. The other thing I do with muffin tins, if I have puppies that eat really fast, instead of buying those slow feeders, so the slow feeder company doesn't like me, is I will take yogurt or chicken broth or beef broth, something else, mix their dog kibble with it, put it in the freezer. And then if you're on a Zoom call, go to work, need the puppy to eat their food slower than they do if you just put it down in front of them, because they'll gulp it down in 30 seconds when you have retrievers. That makes them eat their food much slower. So it takes them like 30 minutes instead of 30 seconds to eat their breakfast. Other fun games you can do. This is a kids' Little Tykes sandbox filled with water and little floating rubber duckies, so the dogs have something to play with. This is one of my favorite tricks. This is honeydew melon. And I took this honeydew melon and cut it in half, scooped out the seeds, and then put it down for my puppies. I cut it sort of like a grapefruit, so it was in sections, and they were having an absolute blast chewing on the honeydew melon. But you can use any fruit or vegetable that's safe. So no grapes, no raisins, no macadamia nuts, but any other fruit or vegetable is really fun for puppies. So you can give them all kinds of new social experiences without ever having to go anywhere, without leaving home, without working very hard at it. So any of the fruits or vegetables that you are eating and your family is eating, you can share with your puppies. I did this with a litter of farm dogs as well. And the client that bought the farm dog, one of the farm dog puppies from me, called me one day and she said, "Did you give the puppies cantaloupe when they were babies?" I said, "Honeydew." And she said, "Oh my gosh." She said, "I cut into a cantaloupe the other day and Ember went crazy." So they remember this stuff. A year after he left my house as a baby, he remembered having honeydew melon. One of the other things that I did, because we couldn't get our puppies out as much during some of these either cold winter days or during COVID, was to give some variation in environments and footing. So I've raised 6 dogs for Canine Companions for Independence, and some of them get a little funny about certain surfaces under their feet. So I went to Walmart, my favorite store, and at any given time at my local Walmart, you can buy 11 styles of bath mats. So I bought 2 of each one, put them all in this box for storage. But I wanted to show you that this is pretty fun because you can do a lot of things with these. For one, I put this mesh one underneath the puppies when they're really young, this mesh one on the right, so that when they're under 2 weeks old, if they're laying there and they've urinated and mom hasn't quite gotten it all licked up, the water or the urine drains through here. So they're on a good surface with good footing. They're not slippery, but they can get heat through it, but the urine runs through, the stool doesn't stick to it too badly, and you can keep the puppies clean and dry. And these mesh mats will just go right in the washing machine. I don't put them in the dryer, I hang them to dry, but you can put in the washing machine and they can stay clean and dry. And this keeps your puppies much drier than they are if they're just on a regular surface. They also come with all these different styles. So this is one with bristles on the right, the left-hand side. So there's a bristly one, there's one with square holes, there's some with round holes, there's some that are slatted like this gray and white one. There's some that are kind of a mesh. There's some that have round holes, some that have square holes, some that are shiny, some that are not shiny. So I can give them all kinds of experiences. So without ever leaving home, I can go to Walmart, buy 11 styles of bath mats, and then I have 11 social experiences for my puppies. So Ian Dunbar and Sophia Yin have talked a lot about 100 experiences for your puppies in 100 days. And it's hard to get them to meet 100 people or have 100 other experiences. But if you can do 10 kinds of fruits and vegetables and 10 bath mats, you've just done 20 of those without ever working very hard at it. So a lot of things can be done really effectively at home with the right kind of socialization. This is just a full-length mirror, kind of fun to put on the outside of the X pen where the puppies are. They can see themselves through the full-length mirror. Kind of fun to play with that. These are exercise boards. Now you can buy the dog ones, or you can just buy this exercise board for people. And again, puppies can stand on this and get different experiences. I have built little tiny baby agility equipment. So I've got little teeters and little dog walks in my puppy area. I've also put in a rabbit hutch so that they've got some areas that they can go up and down on. So you can teach little baby agility courses. And then as far as other things go, these are a bunch of kids' toys. Either I bought at garage sales or didn't buy it all because they were sitting on the side of the curb at somebody's house that they were throwing them away. So I'm that crazy person that drives up in the minivan and picks up that stuff that's sitting at the side of the road. So all these are kids' toys that I paid under $2 a piece for. So I've got the lawnmower that makes noise. I've got these other things that roll and make funny noises and are cool colors. This is a baby bathtub on the left-hand side. Again, it's just something that the puppies can climb in and out of. Other kids' toys, they're bright colored, they make interesting noises, they move in funny directions. So these are all really great things that you can do for puppies. This is a kid's walker that was thrown out at the curb, so nobody wanted it anymore. It doesn't work very well for putting a kid in, but it works great for puppies to play with. There's all kinds of toys, all kinds of fun stuff. This is my little baby agility equipment, the dog walk and the teeter. You can see it's been loved a little bit and chewed on a little bit, but nevertheless kind of fun. These are little kids' rocking chairs. You can buy these on Amazon for around $20 a piece. The puppies love to sit in these, and it gives them the experience, sort of like these other devices back here, that they have some instability under their feet. And by doing this, they just learn that going up and down stairs and going around in other places are not quite so scary. So it's kind of fun. So we have a little bit of time left. So we're going to go through some sick puppy stuff. And we'll talk about some of the symptoms that we see with sick puppies. The challenge with these are all symptoms that we frequently see in sick puppies, but they're not particularly specific to what the disease is. So you may see puppies that aren't gaining well, they're not nursing well, they might be either crying too much or not enough. It may look like they've been rejected by the dam. I personally don't think that many dams reject puppies, but I do think puppies get left behind when they're sick. I think a lot of puppies, when they're active and they're doing well, they swarm together. They move around the whelping box in swarms like bees. And if you have a sick puppy that's cold or for some other reason is sick, it tends not to swarm with the other puppies. So it may look like the mother has pushed the puppy away. We see puppies with vomiting and diarrhea, fever, dark urine color, abdominal distension, coughing, sneezing, or nasal discharge, or the death of a litter mate. So these are all symptoms that we frequently see, but don't specifically tell us what's wrong with the puppy. So what I'm going to talk about are the diagnostics that can be done to try and nail down what the problem is with your veterinarian and to treat for the treatable. Because sometimes you don't know what you've got, but you treat knowing that if you treat for the things that most commonly will work, you may save puppies that you will lose if you just kind of stand idly by. So now that we have pretty sophisticated equipment in small animal veterinary clinics, it takes itsy bitsy tiny little blood samples to run a CBC, to run a chemistry panel, to run urine samples. So it doesn't take very much blood to do a lot of these tests, including DNA testing. So it's really valuable to have a veterinary clinic that's willing to draw blood on puppies and willing to run some of these diagnostic tests. I typically roll my puppies onto their back and draw their blood from their jugular vein from their neck. They don't fight as much. They don't squawk as much. They're a lot easier to handle. So I've had good success with that and have very successfully been able to draw blood in that position with a technician holding the puppy on their back. Urine testing, again, you can check for specific gravity, bacterial infections, organic acids, and DNA. For x-rays, as you can see, this is not an x-ray, but this is an empty soda bottle or pop bottle. You can do a water bottle or a soda bottle, anything you want. But if you're trying to take x-rays of a puppy, it works really well to put a puppy into this bottle so that the x-ray technicians don't have their fingers on the x-ray. It's hard to hold a puppy still when they're taking an x-ray, but almost everybody's got an empty water bottle or a nearly empty water bottle laying around someplace. Now, this is one of my corgi puppies. He was not sick, but I was preparing slides a couple of years ago. And I said, well, dude, we're going to just show how this looks. So you cut the ends off of the bottle, put the puppy, slit it, put the puppy in the bottle, and then you can see that this will hold the puppy really nice and straight for x-rays. So if you're watching your vet techs struggle to get x-rays, you can do this. This is a great example of x-rays on a pair of litter mates. The puppy on the left-hand side is normal. The puppy on the right-hand side is not. This puppy on the right-hand side has pectus excavatum, where the chest is caved in. Now, it's a really great tip to take a normal puppy to the vet clinic with you if you have a sick puppy. So take a normal litter mate along if you have one, and allow the veterinary clinic to run a blood sample, examine the puppy, maybe x-ray the puppy as a comparison to the other puppy, because it's kind of hard to tell what normal is if you don't know what it looks like. So taking a normal puppy, x-raying it and comparing it to the sick puppy very clearly shows you that the sternum on this puppy is right down here, and you can see the puppy has a nice wide chest. But if you look at this puppy, you can see how the sternum goes up and it compresses the heart, compresses the lungs. This puppy is going to be struggling to breathe because of pectus excavatum or swimmer puppy. If you have a puppy that's not nursing effectively, or they're starting to regurgitate or vomit, you can give a barium swallow to a puppy and see if they have a normal esophagus. This puppy does. On an ultrasound, you can see all kinds of things on even very, very young puppies. This is a normal kidney on a puppy. You can look to see if they've got a ruptured bladder, if they've got anything else going on. So really valuable information here. This is a puppy with hydrocephalus. So it's a puppy that has an open fontanelle or a soft spot on the top of its head. And by ultrasounding the puppy's skull through that little opening, you can see that this puppy has 2 large chambers of fluid in the puppy's brain. So this is a hydrocephalic puppy. This puppy has really very little chance of surviving. So good to know this information on ultrasound. Other things that you can do for treating. So we're going to talk about treating with fluids, glucose, electrolytes, antibiotics, vitamin K, parasite control, and kaopectate. So this is the basic supportive care for any sick neonatal puppy. So these are the things that we do pretty routinely along with plasma. I didn't list plasma because we've already talked about that. So a sick puppy, if it's dehydrated or you're concerned that it's not getting enough to drink, or it might be losing a lot of fluid from diarrhea, you can very easily give fluids to the puppy subcutaneously, orally with a feeding tube if it's not vomiting, or a bottle, and intravenously if it's a large enough puppy to get a catheter into a vein. I don't personally use fluid in the abdomen intraperitoneally. There are some people who talk about it. I personally have not been very happy with that particular technique, but it does work to give it subcutaneously, orally, or with an IV catheter. If the puppy is hypoglycemic, the glucose is low, you can give Karo syrup, you can give the sweetened condensed milk. We talked about this last night. This is the bottle instead of the canned version of it. I don't know if they sell it this way in Canada. They don't sell it at all the stores in the US this way, but some of the bigger retailers have it. And this way you can open the bottle of sweetened condensed milk, have a little bit of it taken out to give to the puppy, and then not have to worry about what to do with that whole can of sticky, goopy stuff. It also helps a puppy that's constipated to give this kind of high glucose containing fluid. It'll help with constipation. Next is electrolytes. So if we have a puppy that's dehydrated, you can use the Puppy Light formula. It's got a chicken soup base, so they'll drink this pretty readily. It also works for bitches that aren't getting enough to drink when they're lactating. Antibiotics, I don't routinely put everybody on antibiotics, but if any puppy is born with meconium, which is the first fetal stool, you can see on the outside of this puppy that was born by C-section, this yellow stuff, that's the first fetal stool. This is a puppy that was born distressed. Number one, it's distressed. Number two, it probably aspirated some of this fecal material. So we're going to want to put that puppy on an antibiotic. I use a lot of Clavamox. You can also use a cephalexin called Naxel, which is a large animal product. That's given by injection. So if we have a sick puppy that I can't identify the problem with, if it's crying uncontrollably, if it has sepsis, a blue belly, that distended blue belly where you know the puppy's going to die, any of those things, you can get the puppy started on antibiotics. If it's an injectable antibiotic, contrary to what we do in most dogs, the subcutaneous method in a young puppy is actually a better absorption of the antibiotic than if it's given into the muscle. Here's another puppy with meconium on the outside. So when they're born at C-section with that yellow fecal material on them, we start them on antibiotics right away. We can nebulize if they have pneumonia with an antibiotic. If we're starting an antibiotic, we're going to want to use a probiotic. The Fortiflora product is great for puppies. You can also use it as a preventive. So I love the Fortiflora. It's got a chicken base to it, tastes good. You can get that down puppies pretty easily. Vitamin K, I will use this if we have a puppy that's bleeding just spontaneously, or if they've had a tail dock or dew claw removal, we can give vitamin K for them. The dose for that is 0.1 cc's intramuscularly. You can also give plasma if the puppy isn't doing well, if it's bleeding, so that you can get the bleeding under control. And then parasite control is super important. A lot of people are not aware of this particular protocol. I've spoken about it quite a bit, so hopefully you've heard it before. But if we put the pregnant bitch for the last 3 weeks of her pregnancy through the first 2 weeks of lactation until the puppies are 14 days old on fenbendazole on a daily basis. And the label says 3 days, but this is a 5-week course. This will prevent the migration of roundworms and hookworms across the placenta and across the mammary glands and into the puppies. Again, this is an article that was published in 2002, so 20 years ago, but it came from information published 40 years ago, 1983, talking about this protocol. So you don't have as much of a problem with parasites in your Canadian dogs as we do in the southern US dogs. But if you've imported dogs from southern US and you're having problems with parasites, this is a great protocol to follow. I use for coccidia, I use Albon. I rarely use Panazaril. I only use that if I've got a resistance problem. I never reach for it first. And then if I do have puppies with diarrhea, I use kaolin and pectin, which is actually kaolin and pectin, not the same thing as kaopectate. So you can buy that at the farm stores. For puppies that are inconsolably crying without any reason that you can figure out, so you've warmed them, you've fed them, you can't figure out what's going on, you've pottied them, they're still screaming, you can give butorphanol. It is a controlled substance. It is only sold through a veterinary clinic, so you're not going to be able to go out and just buy this on your own. But if you have a puppy that you can't do anything else with, butorphanol is safe for really young puppies. Sometimes you just have to break that cycle of crying. If they're colicky or they're painful, if something's wrong, they'll stop crying, they'll start to nurse again, and then they'll turn around and get better for you. Postmortem exams, if you lose a puppy, and it's very sad when that happens, but do not put the puppy in the freezer, do not bury the puppy, take the puppy to your veterinary clinic and have a postmortem done on that puppy to find out what's wrong with it. Now, this is a puppy that was born at our place by C-section. This particular female puppy had a cleft palate, which you can see on the left. The right dot, or the shoulder between her, the dot between her shoulder on the right picture is spina bifida. And then on this puppy, between her back legs is her intestines. Off to her side is her placenta. So this puppy had all 3 midline defects, both spina bifida, or all 3, spina bifida, cleft palate, and open abdominal wall. You don't need a postmortem to figure out what happened with this puppy, but it's pretty clear that this puppy isn't going to survive. However, if you lose puppies and you're not sure why, you're losing the opportunity to figure out what to prevent happening the next time. So I always encourage you to have a postmortem done either at your vet clinic or by sending the puppy in for diagnostics. This is a diagram that we've drawn for just educational purposes so that it kind of shows the different layers as you're opening up a puppy. This is a little Irish setter puppy that was born in our practice a number of years ago. Client brought her in because she died and she was concerned that the rest of the litter would be affected. This puppy did not have a large intestine. That's not contagious. So we knew immediately that this puppy wasn't putting the other puppies at risk. However, this is my corgi puppy that I talked about last night for dipping the cords in the tincture of iodine instead of the chlorhexidine. This puppy died. You can see he has a full stomach. This is his stomach right here. His intestines look normal. His chest looks fine. But he had the ascending infection that went up his umbilical cord and into his abdominal cavity. And you can see from these flecks of white material, this is fibrin on the outside of his intestines, that he died from an umbilical infection. So I learned from this, and I will never, ever lose another puppy to that in my practice or in my world. So that's what we have for you tonight. We're not going to get to normal puppy development because it's just too much material. So we'll have to do this another time. But I'm going to just flip through some slides here till we get to the end of what we're going to talk about. So we can always do this another time. I do want to talk a little bit about Purina before I hand this off to Alice. This is one of my clients that started coming to us about 3 or 4 years ago. He had moved to Wisconsin. He breeds miniature dachshunds, and he came in and he said, Dr. Greer, I'm really struggling with fertility in my dogs. He has 10-pound dachshunds, mini dachshunds. And he said, I'm only getting 3 puppies on average out of my litters. And first question, second question, and third question I ask very consistently is, what do you feed? And he told me what he was feeding. I'm not going to mention the brand tonight, but I'm going to tell you that it's an off brand of food. And I said to him, immediately, you need to switch to Purina Pro Plan Sport 3020. He's like, are you sure? I said, yeah. He said, well, I have miniature dachshunds, but I also have a large herding dog or a protection dog, guard dog for my sheep. I said, no, you need Pro Plan. So we went to the store, he bought Pro Plan. And he went from having an average of, this is his little farm where he has his guard dogs and his guard dogs and his sheep and his dachshunds. This is his actual farm. He went from having an average of 3 puppies a litter, these are his dachshunds, to having an average, this is his daughter, of 7 puppies in each litter. All he changed, it was 3 bitches. All he changed was the dog food. He didn't change the flea and tick. He didn't change the supplements. He didn't change the environment. He didn't change anything else. He went to the Pro Plans Sport 30/20, and he doubled his litter size, more than doubled his litter size in just one change. So I want you to think really seriously, if you're struggling with fertility on your males and or your females, exactly what's in your feeding program. And he's also finding that it's costing him less money than it was because he's having to feed a lower amount of dog food because it's more efficient for his dogs. So these are some of my dogs. These are my farm dogs. I had a litter of 4 with this little bitch. This is my current litter. I have 7 puppies in this litter, so pretty happy with this little crew. Don't forget we have our books. So if you're looking for additional information, there's great information in the books. I know they're available on Amazon. I think somebody said they had trouble on Amazon Canada, but I checked and Alice checked and said that she thinks that they're out there. So I want to thank Pro Plan for sponsoring us tonight. And I'm going to turn this over to Alice.
Hello again, everyone. I'm Alice Keith with Pro Plan. Before we take a break and do Q&A, I'm just going to say a few words. First of all, thanks to all of you for joining us for these 2 sessions, for your participation in the Q&A, and Dr. Greer for that wonderful presentation once again, and also for sharing that awesome Pro Plan client success story. We'd love to hear it. If you're not already a Pro Club member, and if you're interested in trying the science-backed veterinarian recommended nutrition of Pro Plan, our breeder program offers great benefits, including savings on every purchase of Pro Plan through rebates or breeder discounts at select retailers, free delivery for large orders in most regions of Canada, and what we think are the best puppy kits on the market for your new pet owners, including a small bag of Pro Plan, 3 cans of wet puppy food, savings on the Fortiflora probiotic supplement that Dr. Greer mentioned, a puppy care guide from our experts, and more. So to learn more or sign up online, please visit us at purita.ca/ProClub. So we're now going to take a 5-minute break. So let's come back for 8:46 p.m. Eastern Standard Time. And feel free to add any more questions that you may have into the Q&A box while we're on break. And I know that Will and Dr. Greer will get to as many as we can. Thanks, everyone.
Hi, everyone. We're back. I want to remind you that keep the questions to topics that we'll cover this evening. Nothing to your specific dogs, and we will do as many questions as we can, and we'll be wrapping up at 9:30 Eastern Standard Time. Are you ready, Doc?
I am. There's
right.
a lot of good questions I've been reading.
I can see that, yes. All right, Carolyn writes, what is the evidence to breed a bitch back to back if she's mature but not old bitch, but you wonder about her fertility and say she just put a litter on the ground?
The recommendations currently are to breed back to back, not to skip a litter or skip a heat cycle in between. We used to say breed, skip, breed, skip, breed, skip. And now we know that a pregnant uterus is a healthier uterus, so we recommend breeding back to back. However, I will only breed 2 litters and then I'll skip and then breed 2 again in a row. There is pretty strong evidence from some research that it takes a bitch 8 months to get nutritionally back to where she was before she was bred. So I'll do 2 in a row, then skip, and then do 2 in a row so that she has a chance to nutritionally regain some of that, like the DHA, like some of the other nutrients that she needs.
Okay. Ashley writes, when should plasma be used with neonates? No colostrum, little colostrum, and is there a benefit to using your own bitch's plasma versus others? What is the preferred method to administer?
Sure. So administration can be with feeding tube if the puppy's under 12 hours old, if it's over 12 hours subcutaneously. The problem with using that bitch's plasma is most of the time bitches are pretty anemic by the time that they have their litters. So the last thing we want to do is take a dog that's just produced a litter. She's anemic already from everything she's put into the puppies, and then take blood out of her. It takes 3 times as much fluid blood as you get plasma. So if you want 16 cc's of plasma, it takes 45 cc's of blood to get that. So that's asking a lot out of a bitch. There were some other questions about why a male. Number one, they're usually bigger. Number two, they haven't had a pregnancy. Go figure. But there is concern that a bitch may have had some microbleeds at the time of her pregnancy, and that she will have antibodies in her bloodstream to the plasma or the red blood cells of the puppy. So that can cause an allergic reaction with a transfusion, with a plasma transfusion. So the recommendation is to use a male dog and to not use that dog of your own, but to find another dog in your kennel. If you don't have that situation, then we do encourage you just to buy the plasma from a canine blood bank that's available in your country.
And Susan writes, what are your personal thoughts on back-to-back breedings? How many would you do, if any? Does litter size play a role in deciding whether to do this or not? How long a break should the bitch have after litter? And if you don't do back-to-back? I think we covered this, but
yeah, pretty much. But if she had a litter of 16 puppies, I'd probably give her the next heat cycle off. If she had a reasonable size litter, I'd probably breed her back to back. And we do see litters of 16. We had a litter of 17 puppies born by C-section at our practice a couple of weeks ago. That girl needs a vacation. She needs a trip to the spa.
yes. Can you repeat what formulas you recommend?
Yeah, I use Foster Care by Revival. I love the Royal Canin of puppy formula, the puppy milk replacer. And I like Esbalac goat's milk version. So those are my three preferred ones. If I lived in Canada, I would only use Royal Canin, but we have to smuggle it into the US. So I try not to break the law.
Okay. Cleft palates. Oh, Brandy asks, cleft palates, what are your thoughts on them? Do you think genetics? Do you always recommend folic acids to the breeds more prone? What's your dose? When do you start folic acids and stop? Also, have you ever heard excess vitamin A can cause congenital malformations such as spina bifida and cleft palate?
Yes. So yes, excessive amounts of vitamin A, like too much liver or too much supplementation from vitamin A, yes, it can definitely cause midline defects. Number two, there was an article published out of Poland. So if somebody wants to see the article, I can email it to you, that showed a decrease in the two brachycephalic breeds by 30 to 60% of cleft palates when folic acid was supplemented. So it does reduce it. It doesn't completely eliminate it. If you have the genetics for it, you're going to have the genetics for it, but you can decrease the expression of those genetics by supplementing with folic acid based on the article out of Poland. There is no good published dose for that in the dog. It's somewhere between 400 micrograms and 5 milligrams, depending on the size of the dog. Large breed brachycephalic dogs would get a larger dose. Small breeds would get a smaller dose. 400 micrograms is typically the size that most of those capsules come as. And if you're going to do it, you need to start at 6 to 8 weeks before she comes into heat. So if you wait until she's ready to be bred, you're 8 weeks too late. We know in humans that you need to start at 6 weeks before the pregnancy is conceived. So if you think you're going to breed her on the next heat cycle, start her on it now, because everybody's like, well, she'll be in heat in March. And you know what? She comes into heat when she wants. So you can tell me all day long she's going to come into heat in March, but if she comes into heat in January, well, it's too late. So start her now. Folic acid is cheap. It's safe. You can't really overdose it. So start it as soon as you think you're even remotely thinking about breeding her on the next cycle. Did that answer everything? I think that was all of the questions.
I think so. I think you got it all. Shannon writes, when you were talking about DHA, my Boston Terrier is epileptic, and I feed their vet diet NeuroCare that is high in omegas and DHA. I feed this to my bitch when pregnant and grind it up after they start eating their moose.
Mm-hmm. It is a great diet, and it probably will help the males with fertility as well, because the anti-inflammatory effects and the fatty acids in those diets, those are amazing diets. So NeuroCare is great. Bright Minds is the over-the-counter version. It's got 1/3 the amount of the nutritional supplements in it, as I understand it, compared to the NeuroCare, but they're both great diets and they are absolutely fine for breeding dogs, males and females.
Gail writes, when switching to ProPlan 3020, would you still add supplements such as vitamin C, salmon oil, kelp, etc.?
I don't think you need all of those things. I think that the nutritional completeness of the 30-20 diet is quite adequate, unless you've seen, something going on in your lines that you're particularly trying to address. I had a client a couple of years ago that called us, and he wanted to come in because he was missing pregnancies on all of his bitches. No bitches at his kennel were getting pregnant. He had a line of golden retrievers that went back 50 years. His in-laws had been breeding Goldens for 50 years, and they had no fertility issues, but he took over the kennel and they were getting nothing pregnant. Now his dogs were still getting outside bitches pregnant, but his bitches were not cycling. And if they cycled, they weren't getting pregnant. And my first question, like I said before, my first, second, and third question is, what do you feed? What do you feed? What do you feed? Because sometimes you have to ask a few times before you get the actual answer. And he said what everybody says, oh, I feed a really good diet. Like, well, what does that mean exactly? Tell me what you mean by a really good diet. He said, well, my in-laws used to raise mink. And so the feed mill made a mink food for them that was customized for our breeding program. Like, okay, so something's going on with that formula. You need to go to the feed mill and find out. By the time he came in 2 weeks later, he'd gone to the feed mill, and it turns out that whoever was making the food for him at the feed mill was still using the same macronutrients, the protein, the carbohydrates, and the fats, but they had not added the vitamin pack and the mineral pack for the last 2 years. Now, I don't know if it got expensive or if somebody forgot, or if they, I never got an explanation for how that changed, but they stopped adding the vitamin pack and the mineral pack, which coincided with the bitches not cycling. I said, you need to go to the store today and buy a bag of Purina and get your dog started on it right away. By the time he came in 2 weeks later, 2 of the bitches were already cycling, the bitches that he'd been waiting for. The older bitch, he let me progesterone time. We got her pregnant. We progesterone timed her, we bred her, she got pregnant. The younger bitch, he said, you know what, I've got some time. If I miss her on this heat cycle, that's okay. I really can't afford to do the progesterone testing because my breeding program is falling apart so badly, I can't afford it. So I'm just going to breed her. Well, he bred her. He brought them both in 4 weeks later for ultrasound. The older bitch that we progesterone timed was pregnant. The younger bitch was not pregnant, but when we progesterone tested her at the ultrasound, she had never ovulated. So it was that dramatic of an effect that micronutrient, vitamin and mineral that his dogs were depleted of had just totally shut down his breeding program. And he didn't know it because when you looked at the kibble, when you smelled the kibble, when you touched the kibble, it seemed the same as the food he'd always done because the vitamin pack and mineral pack were such small amounts of nutrients that you couldn't tell. But when you read the bags of dog food and you're trying to compare ProPlan to something else, you look at the fat, the protein, and the carbohydrates, they may look the same, but I'm going to tell you the micronutrients that are in the Sport 3020, the ProPlan, are so finely tuned for appropriate nutrition for all stages of life, including reproduction, that's where the rubber hits the road, is in those micronutrients. And you cannot easily compare those reading the backs of bags of dog food. So stick to your Purina. The ProPlan is going to be the diet that you want to be feeding. The ProPlan, the NeuroCare, the Bright Minds, one of the Purina products it's worth it because it's going to change your breeding program. And if you don't believe me, change half of your dogs, keep the other half on what you're feeding, and see what happens 6 months down the road. And I'm going to tell you, you're going to switch everybody to the ProPlan.
Well, this goes right to another ProPlan question. Susan writes, do you start puppies on ProPlan 3020? Do you alter your feeding for large breeds?
I do the 30-20 unless I have a large breed puppy that seems to be growing too fast. And then I'll slow them down. If they're getting that kind of bulge at the carpus, at their wrist, when they're about 8 to 12 weeks old, some of them are just on a little, that diet might be a little hot for a rapid growth phase. So you may want to switch them to a regular adult food. But in general, the ProPlan is a very good diet for all stages, including growth and pregnancy.
And Lynette just wanted to bring up, last night you mentioned about a signed book, and she asked again about how to get that.
If you email me at vv@caninestore.com, this slide, we can arrange for a book to be sent to you. I know I got a couple of emails yesterday about it, or this morning about it. So please feel free if you're looking for a book, that we're happy to get that for you.
Deborah asks, do you like Nature's Pharmacy puppy back milk for puppy formula for puppies?
I personally don't use it because I'm so happy with the foster care, the Royal Canin, and the Esbalac that I have no reason to try something else. I know those three work really well for me. So I'm going to stick to a product that I know I'm not getting nutritional cataracts and diarrhea from.
Stacy asks, I have toy dogs. Is 30-20 appropriate for maintenance or just for gestation?
It's appropriate for most dogs for maintenance. If they're spayed or neutered and they're getting a little chunky, a little chubby on the 30-20, you might have to back them down. But if they're intact and they're active, even the toy breeds will do well on the 30-20. The little dachshunds did great on it.
All right. We did that one already. Yes, we did. Christine asks, how to dose how much to let the newborn puppies less than 24 to 36 hours old nurse on mom if they're not gaining enough weight yet, to allow the mom to have enough of her milk come down in enough quantity to eventually nurse all her puppies.
Yeah. And a lot of people are concerned that if they supplement the puppies with a bottle or a feeding tube, that's going to suppress their interest in nursing. But it doesn't. As soon as you put that puppy down, reflexively, they're going to crawl back over to mom and start to suckle. So that stimulation of the puppy's nursing, even if they're not getting much milk, is going to stimulate mom. And you're not going to tell them that their stomach is full. We have Thanksgiving here in the US tomorrow. I'm going to tell you that all of us are going to be full and we're going to eat anyway. So the puppies do the same thing. Y'all know what I'm talking about. You all have days that you eat a little more than you really needed to, even though you were full, but it just tasted good. So the puppies are going to continue to nurse even if their stomachs are full.
Suzanne writes, when tube feeding, how quickly or slowly do you press the food into the puppy? How do you know when it's full?
I go fairly slowly. I let the puppy kind of champ on the tube, kind of nurse on the tube. And if it starts to gurgle back up, I stop, just pull the tube. And one time I freely admit that this happened to me. One time I thought I was keeping close track of which puppies I had tube fed and which ones I hadn't out of my own litter. And I fed the same puppy twice. I put him down and he started screaming, and I looked at his abdomen and I realized that I had overdistended his tummy. So I put the feeding tube back down and pulled half of the formula back out. So you can feed, you can unfeed. I don't know if unfeeding is a word, but I unfed the puppy. And as soon as I took the too much formula out of his stomach, he settled back down and he was fine. So if you think you've overfed, then just slide the tube down and pull a little bit out and see if that makes the puppy more comfortable. It's kind of embarrassing to tell you that, but I'm going to be honest, it happened.
Leah asks, Dr. Greer, would you care to speak about short palates? Apparently this sometimes occurs in bulldogs. Short palates being the top soft palate ending, say at the back of the gums, not at the throat. What to feed this puppy? When to wean? Is surgery even an option? Anything you can add is appreciated.
Those are tough because there really isn't a surgery that stretches the palate. You can shorten an elongated soft palate, but you really can't make a palate longer. So it's really a matter of playing with the consistency of the food until you get something that the puppy can effectively swallow. So it might be a thicker food, it might be a thinner diet. You kind of have to just adjust it until you see what that puppy does. There's also a product called Thicket, and I think it's produced under a couple different names as well, that you can add to the drinking water. It's used in nursing homes for elderly people that don't swallow very effectively, so that they don't gag on their water, their iced tea or whatever they're drinking. So you can buy that and you can add that to the water. It's like gelatinous, so it helps the puppy drink water better as well. So you can check with your veterinarian and see if they can get a prescription for you for that product, if you're having trouble getting the puppy to drink. And that drinking bottle works really well for dogs with swallowing defects. So you can teach that puppy to drink out of the Lixit bottle, the one we showed in the pictures earlier. Because if the puppy's drinking with their head up, the fluid's going to run down into their esophagus more effectively than if they're putting their head down and doing the thing with their tongue that all dogs do when they drink, and that's flipping the tongue under and throwing water up into their mouth. So those are all tricks you can use to help that puppy. You also want to look really, really carefully and make sure that there's not a cleft palate way, way, way at the back. Instead of it being in the roof of the mouth, sometimes we'll see a division in the palate, the soft palate way at the back. So it'll be like forked. So get a really good look with your veterinarian and a good light and see what's going on in there.
Cynthia asks, puppy had very loose stools after worming. Any suggestions on meds to help with that?
I use kaopectate, the kaolin and pectin. I use canned pumpkin. Those are probably the best things that I can tell you to use. And of course, a probiotic, just to try and get things straightened out in there. A lot of puppies do react that way to deworming, even if they don't have parasites. So, just be prepared with some canned pumpkin or something along those lines to oatmeal, anything that helps to solidify the stool.
Don writes, litter box training. I have used alfalfa pellets and had issues with puppies and dam eating them even starting at 3 weeks of age. Sorry. Is there a health risk if puppies ingest wood pellets, or is there anything we should check on labels to ensure that they are safe if ingested?
I've never had a puppy eat the wood pellets. I think the alfalfa pellets smell a lot better than the wood pellets. So I'm not surprised that a puppy's more likely to eat the alfalfa than the wood. Corgis will eat cardboard, and I still haven't ever had any of them eat the wood pellets. So I think if you stick to wood pellets, you're going to be, or newspaper pellets, you're going to be happier than the alfalfa. The alfalfa just smells really delicious.
Louise writes, for the first time, I've had a singleton by C-section on Saturday. I worry about the development of this puppy who will not have siblings to play with. Also, I worry about the overproduction of milk from the mother who will only have one puppy to feed.
Yeah, and with a singleton, one of two things happens. Either the bitch has so much milk she can feed the neighborhood, or she doesn't have enough because there's not much stimulation. So this is a great example of a bitch that you can milk the extra colostrum out of and put in the freezer for the next time you have a litter. As far as letting the puppy nurse, I usually take an old sock, or actually 2 old socks, and fill them with either dried beans or rice and microwave those. And then when the puppy's nursing, you can put one on each side of the puppy so it's got something to help support it, because that puppy is going to be trying to support its entire weight with its lips holding on while it's nursing. And that takes a lot of energy. So if you kind of prop the puppy up with those heated microwave socks or with the rice or the beans in them. So this is the perfect place for those socks you don't have a match for. So you have a blue sock and a red sock and they don't match each other. Fill them up with beans or rice, microwave them, get them nice and warm, prop the puppy up. So that will help the puppy to nurse more effectively. And then as far as the single puppies, they do tend to get spoiled. They tend to be a little bratty because they're not used to the touch of another puppy and they're not used to the frustration of another puppy pushing them off the nipple. So the suggestion is to take that rice-filled sock or a stuffed animal or something soft, and several times a day, nudge that puppy, get it used to the feel of another being around it, and push it off the nipple a few times so the puppy learns frustration. I learned this the hard way from one of my own singleton puppies. My very first bitch on her 3rd litter, she only had one puppy, and it was a dangerously aggressive puppy. Because I didn't do these steps. I didn't know that you should do these steps. So it's really important that you're doing something like this with that puppy so that it learns the touch, it learns the frustration, and it learns what it's like to not be the only show in town.
Susan writes, how do you catch up on socialization when it has been missed as a puppy?
That's really hard. Some puppies end up needing some pharmaceutical help with anxiety, with fear. But really all you can do at the point at which you get the puppy is the best you can. And that's as many experiences with as many different people, experiences, environment, surfaces, as much as you can to just try and compensate for it. Some dogs do really well, and they're just a breed that's pretty easy, and other dogs you just never can do a great job. So it can be challenging.
Terry asks, she's afraid she missed it, but how much DHA would you give a puppy, or should you give a puppy?
There's not a published dose. So a small dog would get 1 a day and a large dog would get 2. And that's really the best dose I can give you because we don't have a published DHA dose for dogs.
She also wants to know, what age do you recommend transitioning them to solid food from just nursing?
That depends on the breed. Retrievers are going to transition early. They're going to, by 3.5, 4 weeks, they're going to be going on to a more solid food. My farm dogs, they would still nurse when they were 8 weeks old. Cavaliers, the same thing. It depends on the breed. Now, I tend to be pretty conservative on feeding dry kibble. In my lifetime, in my practice life, I've had 3 puppies choke on dry kibble, 2 golden retrievers, 1 bulldog. It was always the biggest, most beautiful puppy in the litter. And they'd put down the bowl of food and those puppies would go dashing over to the food. And the first puppy there was the big puppy, and it would grab a mouthful of food. And 3 times I've seen a puppy die before we could get to the vet clinic and save them. So I soften kibble probably longer than Purina would suggest that you do. But anytime I've got a puppy that's eating too fast, I like it to be softened so that if they do eat too fast and aspirate, they can cough it back up. So I'm typically the person that softens food until their adult teeth are in at 5 months. My husband doesn't like that. I do it that way. Poor guy. He loses this a lot.
We get used to it.
Yeah, I don't know.
Julia asks, environmental activities, I also include scents, introduce a new smell of a day. Oh, let me do this again. Environmental activities, I also include scents, introduce a new smell a day for about 2 weeks. Is this okay?
It's great. If you have the wherewithal to do it, that's super. A lot of people can buy little scent kits. They'll start doing that nose work kind of practice stuff with puppies before their eyes are open. I think that's pretty fun. But you can do pheasant wings, you can do fruits and vegetables, you can do all kinds of things. So, you don't have to do anything fancy or official. But boy, the more exposure puppies have to different experiences, the better off they are. So if you have the time and the energy to do it, I'd strongly encourage it. The people who buy your puppies are going to love it.
Tiffany writes, how many ultrasounds do you recommend for a pregnant bitch, and at what stages of pregnancy?
So I typically ultrasound it about 4 weeks after the breeding. If everything looks normal and the bitch has a normal reproductive history, I don't typically ultrasound again. We'll do a puppy count x-ray before the bitch is due, and that's all I'll do. If it's a bitch that we saw resorption sites at the ultrasound, if she has vaginal discharge, if she's not feeling good, and we do a progesterone at every pregnancy confirmation ultrasound, we do it 4 weeks. If that progesterone isn't as high as I want it to be, then those are the times that I'm going to be monitoring those bitches more often. If the bitch had a history, like her mother aborted puppies or didn't carry a pregnancy to term, I'm going to be checking her every 7 to 10 days. So it depends on her history, on the progesterone, on if she's merrily eating and getting bigger and everything looks great, I just do one. If I'm worried about her, I'm doing it every 7 to 10 days.
Anne Marie asks, is it safe to give Pedialytes in subcut?
No. You need to give sub-Q fluid subcutaneously. Pedialyte is meant to be an oral product. It is not sterile. It will cause you abscesses. So don't give it subcutaneously.
Juan asks, any colostrum you recommend other than plasma, because it does not exist in my country?
Then you may just have to find a large breed dog in your kennel or someone else's kennel that's willing to give you the opportunity to draw blood and use that as your donation for your colostrum substitute as plasma. It's tough if you live someplace that doesn't have a blood bank.
Susan asks, you mentioned dew claws. What age, youngest, oldest, do you recommend they are removed at, if needed?
I do it at 3 to 5 days if they're gaining weight. If they're not gaining, I wait until they are. And I will do it as late as when their eyes are opening, if I need to, because they weren't gaining when they were younger. And I put in a local block. So I put in lidocaine as an injection, so it's less painful. And I give Cairo syrup or sweetened condensed milk. There was a study done in baby pigs when they were castrated that their cortisol levels didn't rise as much from the pain if we gave them glucose. So Cairo syrup, sweetened condensed milk, any of those things, just to kind of help numb the pain will be really useful. But I use local blocks, lidocaine on all my dew claw and tail duct removals until their eyes open. And then if their eyes are open, not until they're old enough to anesthetize.
Natalie asks, if you have a puppy not doing well, temperature and everything is great, do you check glucose? What do you think of corn syrup?
I would start with tube feeding, and if the puppy's still not getting better with tube feeding, yes, I would do glucose. And we use a lot of corn syrup. We use Karo, the light colored corn syrup in our practice. We use sweetened condensed milk. Any of those are fine. They're high in glucose and they really are helpful for those puppies that aren't thriving.
Julie asks, why not use LRS to rehydrate by subcut?
You can do sub-Q injections of lactated ringers, but newborn puppies cannot metabolize lactate. They just can't. So I use normal saline instead until they're about 2 weeks old. And then I switch to lactated ringers LRS. Good question.
Lynette asks, we can't feed our DALs 30-20. What do you suggest?
I'm assuming that's because of their bladders. So I would feed another Purina Pro Plan diet that's just not quite as high in protein.
Elizabeth asks, before I started breeding on my own, my bitch lost a puppy. And when I called my breeder, she told me to wrap it up and throw it in the garbage. Not knowing any better, should a necropsy have been done? The other 3 puppies survived.
It would be good to have a necropsy, but what's done is done. You can't go back and change anything. The good news is you didn't lose any of the other puppies. So if you continue to lose puppies one after the other and you weren't doing postmortems, then you would have lost a lot of really valuable information. So it's disappointing that you didn't get a postmortem, but it is what it is. So all you can do is learn from that experience, and going forward, if you lose a puppy, refrigerate it, do not freeze it. There was another question about freezing puppies. You can still do a postmortem on the puppy, but you can't do histology because the tissues are damaged by being frozen. So you can still do cultures. You can still look at the tissues with the naked eye, but looking at them microscopically, you're not going to get an accurate assessment of what went on because of the damage during freezing.
And Pearl asks, did I understand you correctly? Both the Siren Dam should be on Sport 2030?
Oh, yeah. You want that boy to make good sperm. The better the sperm, the better the litters. So yes, the boys shouldn't be fed any less than the girls.
Christian asks, what can be done to increase lactation after birth to ensure there is sufficient for all puppies?
So the drugs I use are oxytocin to let down the milk and metoclopramide to make milk. So those 2 drugs work simultaneously and collaboratively to help produce better milk. And the lactation nurses on the human side use root vegetables like sweet potatoes and oatmeal. And I learned this from a Newfoundland breeder in my practice, bratwurst. You know, the little sausages the little German ones. I don't know why bratwurst makes bitches produce better milk, but she told me that it worked for her dog. So I have a couple bitches that have not been great at lactation. So I said to my dear husband, you need to run to the locker plant and go pick up some brats. And he goes, oh, I said, they're not for you. They're for Miranda. Go to the store. And he's like, oh, well, he bought extra because he needed some for himself too. But I don't know why brats help bring in the milk. I don't know if it's the salt. I'm not sure if it's the fat. I don't boil them in beer like you're traditionally supposed to do with bratwurst. I fry them. I cut them up into little pieces. I give the drippings to the female. If it's a small breed dog, she may get a quarter or half of a bratwurst. If it's a large breed dog, she can have a full bratwurst 2 or 3 times a day. I don't know what the magic is because it's not fenugreek. That does not exist in the bratwurst formula. I've checked. And then the other thing that also helps is Oxymama, which is a nutritional supplement that Revival makes. Again, like I said, I work for Revival. But that Oxymama stuff, I start that 2 or 3 days before she has her puppies. And again, those are delicious. They're made with a molasses base. Most dogs will eat them. I'm like, if I opened a bottle, my bitch would eat the whole bottle. I don't recommend that. But again, those are the things. So oxytocin, Oxymama, Reglan or metoclopramide, bratwurst, sweet potatoes, and oatmeal is my kind of magic formula.
Charity has a 2-part question on tube feeding. When removing the tube, I've been told to kink the tube to prevent getting leftover fluid into the lungs. Any truth to that? And the other one is the amount given for giant breed puppies that are 1.5 to 2 pounds, 24 to 32 ounce puppies, is the 1 cc to 1 ounce ratio not too much food per feeding? If so, how many cc's would one feed?
No, a 24-ounce puppy can still take 24 cc's. I don't have trouble with that. It just seems, I mean, the bigger the puppy, the bigger their stomach capacity, and that's the formula that you can calculate stomach capacity on. I don't worry about pulling the tube out and any extra fluid going down. I mean, if a drop of milk gets in the back of their throat, they should swallow it. I don't pinch it, I don't kink it, I don't worry about it. I just pull the tube out. I have not lost a puppy to doing that. So I think it works really well just to pull the tube out promptly, don't diddle around. When you're done feeding, pull it out. And then somebody asked about what kind of tubes to use. There are red rubber feeding tubes, which get stiff really easily and they're hard to see through. I like the clear silicone soft tubes. I don't know the name brand, but I use the clear silicone ones. I don't buy stuff at my practice. I have a person who does that. Her name is Lonnie. She's worked for me for 35 years. She knows what I want. I tell her what I buy and she buys it. So I don't know what they're called.
Gabby writes, when you free whelp, what do you prefer to do with the cords and placenta? How much do you let the bitch eat? The runs after a whole litter of placenta is no fun.
Yeah, I don't typically let my bitches eat all the placentas. I'll typically try to get them to eat none or maybe one or two at the end. I've had bitches that have started having puppies, stopped, come to C-section and vomit up placentas when we're putting them under anesthesia. You think it's not fun having the runs? You should try pulling placentas out of the airway. No, I don't like that either. So I try to really limit the number of placentas that they get, maybe one or two. But if they eat them all, you're going to have a mess on your hands. Bitches eat placentas so that predators don't find their baby puppies in their den. I don't have predators walking around in my bathroom. I'm pretty sure you guys don't either. So when your bitches are whelping in the house, it's safe for them to not have to eat the placentas. You can throw those away. Do I treat the cords? Yes. If they're bleeding, if they're too long, I'll tie them off with dental floss. If they're not bleeding, I just dip them with tincture of iodine. And once they're tied off, I dip them with tincture of iodine. We talked about that last night. Hopefully that carried through.
Sherry asks, I have a 4-year-old ETS who started fly biting, snapping randomly at the air, had a CT scan done and diagnosed as hydrocephalus. Is there something I should have tested for before symptoms?
Oh, that's tough. If the dog had an open fontanella soft spot on its head, you might have been able to ultrasound the dog, but sometimes they don't have a soft spot. They can have hydrocephalus and have a normal skull. So no, unfortunately not. There are just some breeds that are predisposed. I've seen it in Labradors, which are not predisposed. I've seen it in brachycephalics. It just breaks your heart when it happens. I've seen it in Laplands. I've seen it in breeds that you just don't think are going to have a problem, but it unfortunately life sometimes deals you a bad deck.
Sandy asks, what's the best way to deal with Giardia and how young can you safely use Safeguard?
Oh, Giardia, the bane of everyone's existence. Everybody at some point is going to end up with Giardia and or coccidia in their kennels if they have more than a couple litters a year. The best way to deal with it is fenbendazole and or metronidazole. Fenbendazole is not labeled for use in dogs in the United States until they're at least 6 weeks old. So you can deworm the bitch, but the Giardia doesn't pass through the placenta. It just gets on the bitch's pants and on her tail. And then the puppies, when they're pretty young, can crawl through that fecal material and end up with it. So keep your bitches really clean. Bathe them before they have their puppies. If they come back in with poop on their feet, poop on their tail, poop on their butt, wash that part of them up so that they're coming in clean. And you really don't want to use metronidazole when she's pregnant or when the puppies are really young, because metronidazole crosses into the brain through the blood-brain barrier. So you've got to be really careful with metronidazole and fenbendazole when they're under 6 weeks old. So really hygiene is your best bet. It's hard to keep a bitch immaculately clean because a lot of them do have loose stools or they step in something when they get outside. All you can do is your best to try and keep the puppies as clean as possible.
Excuse me. Susan asks, what are your thoughts on Breeder's Edge problem female supplement? Also, what are your thoughts on a B12 injection for the bitch and stud?
I use the Breeder's Edge Be Strong product a lot. I don't usually use the Be Strong injection because it only lasts 24 hours in the dog's system. It's a water soluble vitamin. So vitamins B and C are in and out of the system in 24 hours. Vitamins A, D, E, and K are fat soluble, so they stay in the system longer. Now, that being said, one of my employees who raises baby goats, last year, the day she bred all of her does, gave everybody a B12 injection, and she had triplets coming out of her ears. She said, I will never do that again, because she had to bottle feed the third kid in every litter, because she had litters of baby goats. So I don't use the B vitamins by injection, but I do use the Be Strong oral product. The Breeder's Edge female supplements, I think they're fine. I think they're safe. There are people who are concerned about whether it's got cottonseed oil in it causing a problem. I have not seen fertility issues as a result of it, but I typically just use Be Strong and an appropriate diet like the ProPlan Sport 30/20. I think that gives you all the nutrients that you need.
All right, Marceline writes, do you recommend mixing the ProPlan puppy food with Fortiflora when you first start to wean? Does this help with loose stool?
Oh yeah. Fortiflora is amazing. And the chicken base to it is a hydrolyzed protein, so you're not going to have any problems with the allergy reactions. The Fortiflora is a great product. So I would use a sachet per litter per day. If you have a decent sized litter. If you have a singleton, I don't think you need a whole sachet of it. But if you've got a litter of puppies, you just mix it with their ProPlan once a day, and it's going to really improve their stool quality.
Christine
It also,
asks,
we also think it reduces mastitis and metritis, although it's not a label claim. I can't actually say that. But 3 years ago at the repro meetings, they talked about probiotics reducing mastitis and metritis. So I think it's a great way to use Fortiflora. Sorry, I didn't mean to interrupt you.
I'm sorry I interrupted you. Christine asks, how much vitamin A is too much and can cause midline defects? And can cause midline defects.
I don't know the answer to that, other than too much is too much. So I don't use anything with too much vitamin A in it, and I don't add just plain liver, because liver does have quite a lot of vitamin A in it. So when I had a litter of puppies a number of years ago, I had 8 corgi puppies and 3 had cleft palates. I was working with a geneticist at UPenn, and her first comment was, there's too many puppies for this to be genetic. This has to be environmental. Are you feeding too much liver? And I'm like, I didn't feed any liver, and I didn't feed any supplements. So I don't know. So I don't know what too much vitamin A is, but there's a minimum recommended amount for a dog to have and a maximum recommended amount. So usually if you're just feeding dog food, you're going to be okay. But if you're adding liver or other supplements, you might be excessively adding vitamin A to the diet.
Susan asks, folate acid or folic acid?
Those terms are typically used fairly interchangeably, even though they're really not the same thing. So it should be folate, not folic acid, but people use those terms sort of interchangeably. I don't get too excited about the terminology.
Okay. Emily asks, what is your current recommendation for flea and tick prevention for bitches that have upcoming breedings planned? And also, what is the recommendation if we see fleas on a pregnant bitch?
Well, if you see fleas, I bathe her and I flea comb her, and I try to eliminate as many as I can mechanically. I didn't think you had fleas in Canada. I thought you guys were so cold that fleas didn't like it there. For topicals, the topicals that are labeled in the US are Frontline, not Vectra, not Advanix. A lot of them are not labeled for use in pregnant dogs and nursing dogs. So Vectra is not labeled, Frontline is. For orals, there are 4 oral flea and tick preventives in the US. NexGard, Simparica, and Credelio are not labeled for use in pregnant dogs. Bravecto is. I have used Bravecto on my own pregnant dog when I found a flea. So Bravecto is the one that is labeled for use in pregnant dogs and breeding dogs. That's another one of my pet peeves. I have several, is people think that a breeding dog means a pregnant dog. A breeding dog means a dog in a breeding program. So if you have a 6-week-old male puppy that's going to be your next up and coming stud dog, he's a breeding dog. So if the package doesn't say safe for use in breeding dogs, don't give it to your upcoming 6-week-old male stud dog that's going to be your next male in your kennel to be your stud dog, because he's a breeding dog. We don't know what some of these products do because nobody's studied them. I don't think you want to be the footnote in the paper that says that we had puppies that grew an extra leg or had an extra ear. We just don't want that to happen. So read the packaging. If you have questions about the flea and tick products, I can share with you what the US products say on the label. I have not researched the Canada products for what it says on the label. But if anybody wants that chart, they can email me at vv@caninestore.com, that one, and I will send it to you for what the US labels say. They're not identical to what the labels in Canada and the European countries say, but they're pretty similar.
Michaud just wants to know, because of her French, she didn't catch the name. What is the name of the last supplement to feed before pregnancy?
The last supplement, Be Strong. Is that what I said last? Or ICSB CF Plus. So ICSB is International Canine Semen Bank. That's CF is Canine Fertility Plus. You can buy that from ICSB. I use that and Be Strong. And then of course, Revival makes in between for her. They make Oxy Mate for the females. But I tend to use just the Be Strong product from Revival.
Sean asks, can you repeat the different materials for litter box training, and do you increase the size as they grow?
Oh yeah, the litter box should get bigger as the puppies get bigger. My Corgi puppies are really short, so I start with a really shallow pan. You can move up to the pans that go under washing machines to keep them from leaking into your basement. You can come up with storage boxes that you can cut down. There's any tray that you want to use works beautifully. But yes, the bigger the puppy and the bigger the number of puppies, the bigger the tray needs to be. I use the pelleted wood, the pine pellets that they use for horses that look like this. The alfalfa we talked about being something that they eat. They also make a pelleted newspaper. The cedar shavings, I think, are too aromatic. There's too much oil in them, and they can be irritating to the eyes. The pine shavings work too, besides the pine pellets, but the pine shavings tend to stick in the coats of long-coated dogs like Corgis and Samoyeds, and then they track them all over the whelping box, so it makes it kind of messy. So the pelleted stuff tends to stay put better, and you have less vacuuming to do and less cleanup to do if you stick with those products. But if it works for you, if you're using something else, if it works for you, fine. And I was kind of trying to watch the chat and see if anybody else had any other suggestions, and I wasn't able to keep up with it because we've had so many Q&As.
Hannah states, my female Siberian struggled her first few puppies of her first litter, refusing to push as she was confused as to what was happening, and she needed Oxy. Should I expect her to have a better understanding in her second litter of needing to push? She is 3.5 years old now, and her first litter was 7 healthy puppies.
She'll probably do better. The calcium gel will help. The Adaptil or the Thunder Ease collar will help her to just be a little bit more at ease. But usually a bitch that's had one experience with a litter is just a better mom the next time around. So she'll probably do better next time. Guarantees? None.
Sarah asks, my friend was wondering, what could blood in a 6-week-old puppy's stool be from? And what age should a female be bred? What about a male? How many litters should a female have in their lifetime?
Wow, that's a lot of questions. Blood in the stool can be from parasites. So I would start with having a stool sample checked or deworming the puppies with fenbendazole, with parental, with one of those products, maybe Albon. It could be coccidia, it can be roundworms, it can be hookworms. So a lot of things can cause blood in the stool. Blood in the stool can just be from GI upset. If you change diets, if you change water sources, any of those things, anything that upsets the GI tract. So probiotics, pumpkin, all those things can help. What age should you breed the female? Was that the question?
At what age should a female be bred? Yes.
Typically, we say 2 because we do our health clearances so that they are done by the time the dog is 2 to 2.5 years old. OFA in the US doesn't allow for full OFA registration until the dogs are 2. So typically that's sort of that magical age, but from a fertility perspective, breeding a little bit younger than that, 18 to 20 months, is probably better for fertility, but not good for health screening. Hearts, eyes, DNA testing, that can all be done before they're 2, but OFA hips, they have to be 2 years old. Same for the males. And then was there another question about frequency to breed? I think we've kind of
How
covered.
many litters should a female have in their lifetime?
Yeah, probably. I mean, most people will do 4 or 5 litters and generally not more than that. So it kind of depends. Does she like her puppies? Did she have big litters? Did it take a lot out of her? I mean, if she was a lab and had 16 puppies, she may not want to do more than 2 or 3 litters. If she was a Cavalier and she had 4 puppies and she loved every minute of being a mom, Golden Retriever, and she had 10 puppies and she loved being a mom, maybe let her have 4, 5, 6 litters. So it depends on the bitch. I have some bitches that are like, I hate puppies. I'm not going to make her do it too many times, even if she has nice puppies. If she's not happy being a mom, believe her, she should have some, she should have some input into this decision.
And I'm afraid we've passed our 9:30 break off point. So
Already?
we have, yes. It went fast. So it's been a lot of fun. And I want to thank Dr. Greer. Everyone had a great time. I'm sure I had a great time.
So
And I want to thank ProPlan for making tonight possible. But again, thank you, Dr. Greer. That was an amazing presentation.
thank you. Thanks to everybody for coming. We can do more if you have topics that you have in mind. So just let us know what you think, because we can tailor it to what your needs are.
And thanks everybody for joining in.